This is the Fertility Friday podcast, episode number 5. Welcome to the 5th episode of the Fertility Friday podcast. I'm Lisa from fertilityfriday.com, and this is your source for information about the Fertility Awareness method and all things fertility related. If any of the topics that I'm talking about today resonate with you, or if you just want to connect with me and say hello, you can tweet me at FertileFriday. And if you have any comments or questions about today's podcast, please stop by and leave a comment in the show notes. You'll find all of the show notes at fertilityfriday.com/podcast. And today we'll be talking all about trying to conceive. This episode is for women who want to get pregnant. So whether that's now or even years from now, you'll benefit from listening to this episode. And I'm so excited to introduce today's guest, Allison Macbeth, to the show. She has a wealth of knowledge in the field of sexual health and wellness, as well as the field of fertility. She has a specialization in the Fertility Awareness method as well. Allison has a master's of applied science in the area of sexual health and has expert training in sex education, contraception, and family planning. And she's currently a Justice holistic health practitioner. And she's already helped numerous women learn to interpret their fertility signs using the Fertility Awareness method. So without further ado, I'd like to welcome Allison to the Fertility Friday podcast. Welcome, Allison.
Thanks so much. It's great to be here.
Oh, thank you so much for coming on the show. I'm super happy to have you. So I did a little bit of an intro, but maybe you could tell the listeners a little bit about what brought you into the field of sexual health.
Sounds good. So I always had an interest in, psychology and people. And when I was an undergrad student at university, I was volunteering at Options for Sexual Health on their telephone helpline in Vancouver, which is basically our version of Planned Parenthood here. And I loved it, so I decided to turn it into a career. So I went off and got my master's in sex education, and I've worked in various different jobs along the way. I've done a lot of contraceptive counseling. I've worked in HIV. I've done program planning and evaluation. And the most recent thing I'm doing is studying with the Justice Health Works for Women to be a holistic reproductive health practitioner. And it's good. I love it.
That's awesome. And so I'm kind of curious, how did you first discover fertility awareness?
Well, it's quite interesting. I think like a lot of people, when I was younger, I thought it didn't work and it was just something, Catholic people did. And, it wasn't very effective, which is quite a common understanding that people have. But as I got older and I started doing more research, I found some really good science and good articles explaining that it actually is very effective as a method of birth control. It's actually over 99% effective. So that made me very excited. And I started sort of playing around with it myself, just in, looking at my own fertility. And I fell in love with it. I thought it was amazing and awesome that women can know when they're fertile and know when they're not fertile, and how we can also use that information for so many different things about learning about our health.
Yeah, I totally agree, because I can relate. As soon as you learn about it and you actually kind of get over that hump to realize that it actually works.
Yeah.
Because of course it's hard to wrap your head around it in the beginning. I know it took me a little while. It took me a couple charts of seeing like, wait a minute, this is kind of the same every cycle. I can totally tell it. Yeah.
Yeah, it's great. I could talk about it like all day long, really.
Awesome. Well, you're in the right place. And so I guess we could get right into it. When it comes to using the fertility awareness method in terms of kind of the focus on when a woman's trying to get pregnant. So for someone who maybe hasn't heard of it before, what would you tell them? Like, how can the fertility awareness method help if someone actually wants to conceive?
Okay, well, I think the main thing is that it's a way for women to understand their body. We call it body literacy, basically reading the signs of their body to know when they're fertile and when they're not fertile. And of course, if you're trying to get pregnant, that's essential because, you can't get pregnant if you have sex on a day that you're not fertile. So understanding when they actually are close to ovulation is incredibly important.
Yeah, absolutely. And I think that So without that knowledge, I think that it's safe to say that it's possible for a woman to actually try every month. And if she happens to be trying in the wrong window of time, then nothing
Yeah,
could be happening. And she might think that there's actually something wrong when maybe she's just not trying at the right time.
exactly. I mean, obviously, we know lots of women get pregnant even if they don't know anything about ovulation. But, if understanding when you ovulate will increase the chances of getting pregnant and then also help those women who may be struggling or maybe have less than typical cycles.
Yeah, absolutely. So for someone who then is trying to get pregnant, because I think that oftentimes when a woman decides that it's time, there's definitely that feeling of pressure. You don't want to,
For sure.
yeah, you just don't want to get your period that the end of that month, and so it becomes, I've even talked to some girlfriends, and at first it's like, oh, we're just gonna try, but then you have a period or two, and then it really becomes a little bit more stressful.
Yeah.
So when you're trying to get pregnant, what are you looking for? When's the time?
So, the main thing women need to do is to watch for signs of fertility in their body because every day you can know whether you're fertile or not that day. What women do, I'm sure your listeners have probably heard a bit about this already, but there's the main thing to look for is the cervical mucus. So, basically, close to the time of your ovulation, your body will produce a mucus that the woman will see when she wipes, when she goes to the bathroom. So, fertility awareness is all about learning what it looks like and how to observe it and how to keep track of it. And by doing that, she can figure out which days are closest to the day of ovulation.
Oh, okay. And then how does the I guess when a woman's kind of looking to check mucus changes throughout the mucus cycle, and so some mucus days. I know for I'm guessing for a lot of the listeners, and I know for myself, the first place that I got the knowledge and even learning about what the fertility awareness method was with taking charge of your fertility. Um,
Yes, that was the first book I read as well.
yeah, and so it's the base of knowledge that you get from there teaches you to look for sticky, that kind of takes you through the cycle of sticky and then lotiony and then egg white. And of course, each woman as you chart will might notice something different. Could you talk a little bit about the mucus cycle and maybe which days are optimal for trying for conception?
Sure. So the basic pattern, normally for a healthy cycle, because obviously some women may not have a healthy cycle, but for those that do, they'll have their period. There'll be a few days where they have dry days after that, where they don't see any mucus at all, and then they'll start to see a mucus pattern. And the typical pattern for that is it's more sticky and cloudy colored, and then as she gets closer to ovulation, it will become stretchier and more clear colored. And then after ovulation, it will be sticky and cloudy again, and then it will dry up and she'll have no mucus again until the next cycle starts. So I guess the important thing for women to understand is that they may not have that normal textbook pattern that they read about, which can potentially be confusing or frustrating. So the important thing is women track their mucus and pay attention to their own unique pattern of the mucus because everyone is different. And by doing that, she can figure out what what her pattern is and when she's most likely to be able to get pregnant. And the way we determine that is we say, you can't know for sure 100% the day you ovulate without getting an ultrasound every day on your ovaries. But most women will ovulate either the day before or the day after the last day of the peak type of mucus. So once they see that and then it stops, and then they dry up, they know that that last day of peak type of mucus was the day that's most closely associated with ovulation. So that would be the last day of any mucus that's either stretchy, so about an inch or more, or has a clear color, or where they have a very slippery, lubricated feeling when they're wiping. So any one of those three characteristics, the last day of that before they dry up again, is the day most closely associated with ovulation.
Okay. And based on the description there, you wouldn't know that it's your last day on that day because you wouldn't necessarily
Exactly.
know that you're not going to have any mucus the next day.
Exactly.
So I guess the rule of thumb would be if you see if you see mucus, because I know what I love about Justice, I found that when I learned the Justice method versus learning from taking charge of your fertility, there were just different aspects, I guess, that were highlighted. So there was more of a mucus focus, I guess you could say.
Hmm.
And what I liked was the way that it describes the distinction between peak and non-peak mucus,
Yep.
because
Yeah.
then it doesn't leave the impression for someone who is actually trying to use the method for birth control. It doesn't leave the impression that some mucus is more fertile than others, but
Yeah.
it
I
kind
mean,
of,
I was just gonna say the rule is all mucus is considered fertile because you only start to see the mucus as your body gets closer to ovulation and as your estrogen levels start to rise. So any mucus is a sign that ovulation is coming soon. Could be any day now, but you obviously can't predict when that's going to happen, like you said, because you don't know if you're going to have it for 3 more days or if today was the last day. So whenever you see any mucus, you consider yourself fertile. And then in the Justice rules and all the other symptothermal rules as well, you consider yourself fertile for yet another 3 days after that last peak day, because that gives enough time that, if you ovulated the day after the peak day, there's a little bit of extra time there for it depends if you want to get pregnant or not, right? So if you want to get pregnant, there's a 3 extra days to have sex that would lead to pregnancy. But then if you're not wanting to get pregnant, it's 3 extra days where you can wait for the egg to dry up before you're considered infertile again. So that count of 3 days after peak day is important.
yeah, absolutely. And so then when it comes to when you're trying to conceive, because all mucus is fertile, you'd want to have sex any day that you see mucus.
Yep.
But to optimize your chances of getting pregnant, you want to have sex on your peak day.
Yep.
Could you talk a little bit about maybe why like the peak day or the peak mucus is a bit more optimal for when you're trying to conceive?
Sure. So basically, as the eggs develop in your ovaries, they're surrounded by these little fluid-filled sacs that are called follicles, and those follicles produce estrogen. And as they grow and get bigger, as the egg gets more developed and gets closer to ovulation, more and more estrogen is produced. And it's that estrogen which creates the mucus that comes out of your cervix. So higher levels of estrogen mean there's a higher water content. So it becomes more slippery, it becomes more clear colored, and it's those high levels of estrogen that trigger ovulation to happen. So if you're aware of when you have the highest levels of ovulation, that's when you're most closely going to be fertile because those high levels of estrogen indicate that ovulation could happen today or tomorrow. But like you said, you won't know until after the fact because you don't know until you've stopped having that type of mucus. So I guess the trick is, you never really know. So if you want to get pregnant, you need to have sex whenever you see mucus, like you said. I mean, some women have a very regular cycle with very consistent patterns of mucus. So if they just go by past cycles, they could say, well, it'll probably be this day is my peak day. Um, but as we all know, we can't just rely on counting the numbers of days in our cycle because that's how mistakes happen. Because the rhythm method is basically what that is when you count days, and every cycle is different, and it depends on so many things like stress or medication or your overall health. But if you're a woman with very regular cycles and you have the peak day within a day or two, in every cycle on the same day, then it's more likely that that will be your peak day. But you can't guarantee it because you don't know until after the fact.
Because when you talk to women or when you're around women who are trying to get pregnant, I feel that society and maybe just the sex ed training that we got in junior high, the sex ed classes, they've kind of given us certain ideas. And I think one of those really prominent ideas that isn't necessarily true is that when you're trying to get pregnant, the most important thing to focus on is that day of ovulation. And
Right.
so, we have the predictor kits and, testing for the luteinizing hormone surge,
Hmm.
because of the idea that if you're trying to get pregnant, you should have sex on ovulation day, right? So we
Right.
want to pinpoint what day ovulation's happening on, and have sex on that day. So maybe you could talk a little bit about why that's not necessarily the best or
Yeah,
most optimal time to have sex to conceive.
sure. I mean, I guess this is something we should have mentioned before, but the mucus is magical in that it actually keeps the sperm alive for up to 5 days. So even if the woman only ovulates on that one day, if she's had sex, within about a 6-day window, there's still a chance she could get pregnant from that one particular ovulation. So the specific day of ovulation isn't really that important for most, healthy women. If they have a problem with their fertility or if their partner maybe has um, like the sperm aren't quite as healthy, then they might be better off trying to have sex exactly on that peak day. But for a healthy woman with healthy mucus and the man with healthy sperm, the sperm can live several days. So the actual specific day of ovulation isn't necessarily that important.
Yeah, well, and that's one of those myths I hope kind of gets dispelled a little bit because uh, it's because of that focus on the ovulation day when I think the focus should really be on the mucus days.
Exactly.
You just want to optimize your chances. It doesn't mean don't if you take the test and you find out what day ovulation is on, it doesn't mean don't have sex on that day. I mean, sex is great, why not?
Yeah.
But in terms of like trying to conceive and trying to optimize your chances, the when you're trying to get pregnant, if you see stretchy, clear mucus, then that would be the time.
So with the Justice method, the peak day of mucus is the last day of anything that's stretchy or clear or where you have a lubricative sensation when you wipe. So it's not peak day of ovulation or peak day of estrogen is not necessarily the day that you have the most egg white mucus. So you might have no mucus that you can pick up at all, but it's incredibly lubricative and slippery when you're wiping. So in our method, that would be considered the peak day. So it's not necessarily about what you can see, it's also what you can feel, and there's different factors to look at. Another example is sticky mucus. So in Justice, we look at both color and stretchiness. So it could be sticky, as in it's you can't stretch it at all. But if it's that crystal clear color, it would still be considered a peak fertile day. And another thing I wanted to say is we don't actually know when we ovulate for sure. All we can say is this is the day that's most closely associated with ovulation. Because even if we look at the ovulation predictor kits, all they do is tell you the measurement of the luteinizing hormone. So the luteinizing hormone surges. It gets a really high peak at close to ovulation, but it kind of goes up and down in the day or two before ovulation. And all it means is that the ovulation is about to happen, but it's not necessarily that day. It could be the next day. So it's really the only thing that would tell you 100% would be getting a ultrasound every day on your ovaries. So that's I think that's important. Like you said, it's not about pinpointing the day of ovulation because you can't know for sure. But if you know which signs to look for that are most likely associated with ovulation, like the peak day of mucus, then that's the most important part. Does
Okay.
that make sense?
It does. I think that's a really great point, and I think that's a really valuable information to have about the ovulation predictor kits. And I think that maybe I'm a bit biased because after using the fertility awareness method for so many years, my sentiment about a predictor kit is, well, why would I spend my money buying a predictor kit when my mucus tells me when I'm fertile, and when I take my basal body temperature, that confirms ovulation. Maybe you could talk a little bit about what role the temperature plays and why the basal body temperature doesn't actually predict ovulation.
Sure. So basically, the reason women take their temperature when they practice symptothermal methods is that the woman's temperature actually goes up after ovulation, and it's goes up enough that you can see a difference between before ovulation and after ovulation. So what women do is they take their temperature every morning around about the same time every day and put it on the charts. And by doing that, they can see that ovulation has happened because their temperature will go up and it will stay up. So the rule is if you see three higher temperatures that are more than the previous six, that is a confirmation that ovulation has happened. But it only tells you that has happened after, because your temperature won't go up until after you've ovulated. Um, the reason it goes up is that the progesterone that's produced in your ovaries after you ovulate is actually has a thermogenic effect on the body. But you, like I said, you won't have that till after it's already happened.
And
So if you wait to have sex until you see that temperature rise, then it's too late because the egg is long gone by that point.
could you expand a little bit about the thermogenic effect in case any of our listeners were wondering what that is?
Sure. Sorry, so thermogenic just means thermo like temperature. So it means that the progesterone increases your body temperature.
Okay. So then basically, if I'm taking my temperature to, as part of the fertility awareness method charting, the temperature won't help me predict that I'm ovulating because it doesn't go up until after I've ovulated.
Exactly. And there's other things that can affect temperature as well. If a woman is sick or if she's on certain medication, if she stays up really late at night, sometimes drinking alcohol can affect the temperature. There's all kinds of things like that. So it's not as accurate as tracking the cervical mucus, which is very stable, because different things can affect the temperature. And again, you only know afterwards that you've confirmed ovulation happened a few days ago.
Okay. Well, I think I want to backtrack a little bit because we've talked a lot about cervical mucus and I feel like we kind of jumped right into it. And and I guess so for the listener that's so they get the mucus and everything, but let's talk a little bit about what happens outside of that mucus cycle and why you can't get pregnant every single day of your menstrual cycle.
Right. Okay. So basically the what we were told in school, when they tried to scare us all into going on the pill and using condoms, is that, like I was raised this way, and I'm sure a lot of other people were, is that you can get pregnant anytime, is what I heard. So I was very scared of getting pregnant, like most young girls probably. Um, but that's not actually true. You can't actually get pregnant any day. You can only get pregnant within an approximately 6-day window period in every cycle. So the reason for that is the egg that gets fertilized only lives 12 to 24 hours. And then the sperm will only live at a maximum of 5 days when it's exposed to that mucus. So if you take the fertility of the woman and the man together, that creates the 6-day window period around ovulation where a woman can get pregnant. So the mucus is magical. Like I said, it keeps the sperm alive up to 5 days. Obviously, it's a bit less for some people, and everyone's a little bit different, but that's sort of what the research shows. So if you're not within that window period, then you can't get pregnant because there's nothing keeping the sperm alive. The sperm will die within a very short time because the vagina is very acidic, and what's in there will actually work to kill off the sperm quite quickly. And then that's both before ovulation and after ovulation. But in that middle portion, not necessarily the middle actually, it depends on the length of a woman's cycle. But if she can pinpoint that 6-day window period where she has the mucus, which is quite basic, it has fluids in it that basically help keep the sperm alive. So once she can pinpoint that, that's when she'll be able to get pregnant. And then the mucus dries up after ovulation and turns back into a more acidic environment that starts to kill off the sperm again. And there's no egg as well. That's the main thing. You need to have an egg that's alive and healthy, and that only lives for about 24 hours.
Yeah, no, I think that's such good information to learn. I think that it's very freeing to learn how cool your body is. And
Mm-hmm.
I think it's actually kind of amazing that your body is actively like just taking the sperm out most of the time, killing them off left, right, and center. Of course,
Mm-hmm.
when you're trying to get pregnant, that's bad news because it means that there's definitely periods of your cycle where it's impossible. You won't get pregnant because your body's killing sperm. And that makes identifying the period of time when you can get pregnant even more important.
Yeah, exactly.
Because obviously, if you're, I think of, say, a friend of mine who, she works out of town. So she's traveling here and there, and maybe she's only home for a week, in a month. if that's the
Hmm.
case, if that's the reality of your life, it's possible that you could miss the window, repeatedly.
Hmm. For sure.
And so we talked a bit about mucus. We talked a little bit about the different qualities of it, what it looks like. And so let's say I'm listening for the first time. I'm really excited, so I want to go check my mucus. I'm like, what is this mucus you speak of? So how would I go about checking that mucus?
Okay, so the routine is that essentially every time you're in the bathroom or taking a shower or right before you go to bed at the end of the day, or even if you get up at night to use the bathroom, essentially anytime you're in the bathroom, you you do a couple things. So the first thing is both before and after using the toilet, you wipe from front to back with a flat piece of tissue. And the reason it's flat is because you might miss the mucus. You might not see it if it's only a very small amount and if it's crumpled up in a piece of tissue. So the first thing you do is wipe and you feel for the sensation. So when you're wiping, does it feel dry or does it feel smooth or does it feel quite lubricative or slippery? And the reason you do that is because the lubricative sensation by itself is a sign of peak fertility because this mucus can have quite a high water content. So that can make it very slippery. So after you decide how it feels, you then look at the tissue and you see if there's anything there to pick up. If there is, you pick it up with your fingers and you stretch it between your thumb and your forefinger. And you look at it to see how far you can stretch it and what the color is. So, and then what you do is you just remember that throughout the day, every time you go. And then at the end of the day, you'll mark down on your charts the most fertile sign you saw that day and how many times you saw it. And then basically, so it's those three things. So you feel for the sensation and you look for color and consistency of any mucus that you do see. And then by doing that, you can start to see a pattern and you can learn what your normal mucus pattern is. And you can learn when your fertile days are.
Okay, and then so I know for some women, especially when they're starting to chart, maybe the mucus sometimes is a little bit confusing. Maybe they're not
Mhm.
sure if there's mucus there or not there. And could you talk maybe a bit about how, in that situation, she could use an observation of her cervix to kind of confirm what's going on?
Yeah, so that's one really cool thing too about hormones and fertility awareness is that the position of your cervix actually changes depending where you are in your cycle. So most people, we've mentioned the cervical locks, but just in case some people aren't quite sure what we're talking about, it's basically the bottom end of your uterus that hangs down into your vagina. And it's got like a little hole in the bottom, which is where the sperm will go through, and that's also what stretches out when a woman's having a baby for the baby to come to pass through the uterus. So that bottom end of it that hangs into the vagina that you can actually feel with your fingers. So depending where you are in your cycle, it will change. So close to ovulation, it will actually be higher up in your body. It will be more of a straight up and down angle. It will be slightly more open and it will feel softer. And then both before and after ovulation, when your estrogen levels are much lower, it will be at lower down, so it's easier to reach. It will be at more of a tilted angle and it will be more closed and harder. So feeling your cervix every day can be another indication of where a woman is in her cycle. It doesn't really, it's not that accurate by itself to tell when you're fertile, and I don't think any research has been done on using just the cervix alone, but it's certainly a good cross check for a lot of women who want some kind of extra signs or extra confirmation. So that's certainly one thing people can use if they're not seeing a lot of mucus or if they're confused. Another thing we highly recommend is that if a woman's confused or not seeing any mucus, is the first thing to check is to make sure she's actually doing the observational routine correctly. Because it could be that there is mucus there, but she's just not seeing it. So that's something that she would go through with a teacher who could help her figure that out. Um,
Well, because I feel like it's among women who do use the fertility awareness method and they do chart their cycles, it seems like a hot topic of debate how to check. And many women check internally for cervical mucus. And I think that there's a big difference between checking internally and externally. For me, I found that at first I thought that there wouldn't be any mucus or I wouldn't necessarily be able to see any when I was first learning the Justice method of charting. And what I found is that I find it to just be, if you do have mucus, you will see it, but you do have to check enough. And so
Yeah.
you kind of have to get into the habit before you pee, because it's like a reflex. You sit down
Hmm.
and you start to
Hmm.
pee. So,
Hmm.
so it's
Yeah.
definitely harder to, well, it's like, I guess a bit more challenging, or just to get into the habit at first of sitting down, but don't pee, and
Yeah.
check first and
Well,
then
one
check after.
recommendation is to not sit down. So to do the first wipe where you feel for sensation, to do that when you're still standing up before you sit down on the toilet. That way, that reflex to just automatically go pee won't be there if you're still standing up, or it's much less likely to be there. So that's what we recommend as well. And like you said people need to check enough to make sure they actually see the mucus. So that's one thing that's a little bit different about Justice. We say to check every single time before and after you go to the bathroom. I think if a woman's not checking every single time, there's the potential that she could miss seeing some mucus, especially if she's having only a small amount that day. And that would mean she doesn't see it, so she thinks she's infertile when she's actually fertile. So, whether you're trying to avoid pregnancy or get pregnant, that's an important thing that you probably wouldn't want to miss. So, certainly checking every single time is important. And I know in the beginning it can seem like a lot. I've had some of my clients say, like, wow, that's kind of overkill. But really, I mean, you're in the bathroom anyway, you're wiping anyway. It takes a little while to get in the habit, but once you get in the habit, it's very routine and you won't even think about it.
And so I do want to ask you, I want to actually get into the topic of checking after, because I feel like for someone who's hearing that for the first time, the first thing that comes to mind is gross. You want me to check after? um, so first, maybe we can talk about why we can check after, and then we can talk about how that would actually look practically speaking.
Sure. So the reason why we check after is basically when you're using the bathroom, there's muscles down there that you're using, whether you're going to the pee or poo or whatever it is, whatever you're doing, there's this muscle group down there, and everything is contained within that similar muscle group. So when you flex those muscles, even if it's only a small amount, you may not be aware of it when you're peeing, for example, but that will sometimes, quite often, push down the cervical mucus out of your vagina that you may not have seen before you went to the bathroom. But then after you go to the bathroom, you do see it because those muscles have moved it down, which is why it's important to check both before and after. Because there may be nothing before, but there may be something after. So, again, you don't want to miss it if it's there because you might think you're infertile when you're actually fertile.
Well, and for me as well, I've definitely found that to be helpful, because sometimes you just don't see anything before. So I did find it helpful to start checking both before and after, because sometimes I didn't see anything necessarily when I would first check before I went to the bathroom. But after I urinate or have a bowel movement, especially if you have a bowel movement in the sense that there's a lot going on down there. So well, and you're using your muscles, as you mentioned.
Hmm.
And
Yeah.
so it sounds really gross, but it's really not as bad as you think, because,
Hmm.
well, I guess, how would you describe? Because for me, what I would do is kind of, you clean yourself off in that area, like in your anus specifically,
Hmm.
and
Hmm.
then you check by, like, on a separate clean flat piece of
Yeah.
toilet paper, and then you wipe across your vulva and over your perineum, but not your anus.
Hmm.
And the reason I'm being so specific is just to be clear, you're not checking mucus as well as poo on the same tissue. I,
Yeah.
I feel like this conversation needs to be had, although it feels a little bit awkward, because it is possible to do it. And even if it sounds gross, the reason why you're doing it is because with all the action going on down there, and especially if you're on a fertile day, you might find a lot of mucus comes out after that.
Yeah.
And if you don't check, you might not have seen it, because
Exactly.
the mucus is produced in your cervix and it can kind of hang out around there. And then once you exercise, it can kind of trickle out. So uh,
Exactly.
maybe you can expand on that a little bit.
I think you pretty much said that's exactly what it is. Like it's important to check, and you can do it in a way that's hygienic and not really too gross. Um, picking up the mucus with urine on it is probably less gross for people, I think. And you're washing your hands right away anyway, probably. But you certainly can do it in a way that's totally hygienic, and you don't need to put your fingers in a pooey tissue.
Yeah,
That's not necessary. You don't have
yes,
to do
that's not what we're suggesting at all.
that.
And when it
No.
comes to checking after you pee, one of the things that I have found effective as well is to just dab. So you kind of like you check first and then you urinate. And then you just take a piece of paper or a piece of toilet paper and you kind of dab, because your your urethra is
Mhm.
located in a different place than your vaginal opening. So the urethra is kind of closer to the front, closer to your clitoris in that area. So you can kind of dab that area first and get rid of that tissue, and then get a new clean tissue and wipe and
Mhm.
check for mucus. And so
Exactly.
if anyone's kind of wondering how it all works, that's the reason why I wanted to talk about it a little bit more, because it's kind of easy to say check before and after. But
Yeah.
I think that because as soon as you hear that, you're kind of like, what do you mean check after? So,
That's a very good point. Yeah. And, basically you can look at all those tissues after you're wiping. Um, like the dabbing you were saying, you can look at the dabby tissue and see if there's anything on there as well, but you don't necessarily have to touch like a dirty tissue.
yeah.
Yeah. I think your process is good. It's exactly how it should be.
Well, sounds good. And so then when it comes to examining, so you have your clean tissue that you have just wiped with, and there's some
Yeah.
cervical mucus on there. So, what do you look for? How do you check? Do you touch it? What does that look like?
Yeah, so if there actually is any mucus there, you need to actually pick it up off the tissue and put it between your thumb and your first finger. And you're looking for two things. So you're looking for the color of it and how stretchy it is. And those two things tell you how fertile it is. So the color could be cloudy, it could be crystal clear, it could be a combination of those two. It could be yellowy sometimes, it could be sort of pink or brown sometimes if there's some spotting. And then the stretchiness is either sticky, so you can barely move it, like less than a quarter of an inch, or a bit tackier, up to maybe three-quarters of an inch, or what we call stretchy would be anything an inch or more. And looking at the combination of the color and the stretchiness, as well as the sensation when you wipe, like I mentioned before, those three things tell you how fertile you are that day.
Okay. And then when it comes to putting that information on the chart, so for women who are kind of new to the fertility awareness method or maybe have been charting for a little while, and so what do you do when you have a day where you're checking throughout the day and maybe in the earlier part of the day you notice some white colored, creamier type lotiony mucus that isn't really stretchy, but then
Mhm.
towards the end of the day you have a big dollop of stretchy peak type mucus. How would
Mhm.
you record that?
So, what you need to do is record the most fertile sign you saw that day, even if it was only once that day. So, even if there was, this sort of sticky, creamy colored stuff all day long, and then you only had one instance of something that was clear colored or stretchy, you would mark the clear colored and stretchy because it was the most fertile thing you saw that day.
Okay. And so I guess that's just for charting purposes. And I'll just say again that it's all fertile, but when you're
Yeah.
trying to get pregnant, you want to be looking for that peak quality, because that peak quality mucus is what's going to help the sperm live, I guess, the longest.
Yeah. Yeah. Looking at your mucus pattern can give you important information about your overall health and hormonal balance. So, not every woman has the textbook pattern. In fact, a lot of women in our society don't, especially people who have maybe been on hormonal contraception or don't have the healthiest diets or for whatever reason. You can look at that pattern of mucus and you can learn things about yourself. So some examples of what people might see is that they may have no peak type mucus or only one day of it. Others may have continuous mucus throughout the majority of their cycle, different things like that. And that can give you information about your hormone balance, which then if you're trying to get pregnant, you can do things to maybe try and improve that so that you become healthier.
Yeah, it provides such valuable information, especially when you have the reference point that you've been charting for quite some time and you can get a sense of the patterns. And so, for any women who are listening who maybe don't see the perfect charts, so maybe they don't have very much mucus, or maybe they don't, as you mentioned, have any peak type mucus, or maybe they only have a little bit of it sometimes. What would your suggestion be, I guess, in terms of seeking support?
Mhm.
Because I think a lot of women just feel stuck, like, oh, there's something wrong with me, when there is actually hope that you can find a way to improve your overall health and fertility.
hmm Well, this is why, I mean, this is one of the reasons I'm learning this stuff, is because I want to help women to, improve their health and improve their fertility. So what they can do is the first thing I'd recommend is working with a teacher, whether it's a Justice teacher or someone else trained in fertility awareness methods, and make sure they're first thing is to make sure they're actually doing the observations correctly, because it may be that they're just not doing it quite right and they're misunderstanding things. So that would be the first step for sure. And then once they've established that they are doing the observational routine correctly and they are charting correctly, to chart for several months and see, or several cycles and see what's the pattern, where the problem might be. And then they can use that information with other healthcare practitioners. For example, if they want to work with a naturopath or acupuncturist or a nutritionist, diet and nutrition play a big role in fertility and health. So that's a big part of it. And especially if women want to get pregnant, doing the charting and starting to figure out their health several months before they want to get pregnant can be really helpful. And, preconception care can be quite a good thing because it can help the woman improve her health before she gets pregnant, which will hopefully improve her chances for a successful pregnancy and a healthy baby. So, there's a lot of detailed things people could do depending on their particular situation. So, I wouldn't go into that now because it really depends on the individual woman. But certainly, diet and lifestyle changes are very important.
Yeah, I think that's a really good point, because I think that unfortunately maybe a lot of women find the fertility awareness method when they're ready to start trying.
hmm
And I think in an ideal setting, you'd actually have the opportunity to chart your cycles well before you actually are wanting to try,
hmm
because that would give you the opportunity to identify any potential issues a lot
hmm
earlier and then not
hmm
have the time pressure.
hmm
Um, it's a totally different situation if you're just charting, when you're 21 and you're not actually ready to try to have a baby at that time,
mm
and you notice that there's something wrong. Maybe you notice that your cycles are out of balance, or maybe you even stop ovulating for a while. But
hmm
in that situation, you can identify it on your charts, and you've got time. You don't have the pressure to want to have a child. But I think it's a lot different if you find yourself, even if you just found yourself at that point where you're ready to have a child, and then you notice there's something wrong, or your charts aren't looking that well, or after several months of trying, you're still not with child.
Yeah. I mean, I think it was you who posted an article on Facebook the other day from The Onion, that
Yeah.
newspaper that's full of jokes, and their title was something about a woman tries her whole life to avoid pregnancy and now she's afraid she can't get pregnant, or it was something like that. And they were making a joke, but that's actually the reality for a lot of people. We spend our whole lives afraid of getting pregnant, and then, a lot of us are on hormonal contraception for like a decade or, on and off for a number of years. And then when we finally try and get pregnant, it's not happening and we don't know why, and it can be very frustrating. some women get pregnant right away after stopping hormonal contraception. Some people even get pregnant while they're taking hormonal contraception.
Yeah, absolutely.
But for other women, it can be like a year or more before their body returns back to its natural cycle. And I have a client going through that right now, and it's very frustrating because, we're not told this stuff when we're younger. And although some people are fine, like I said, and can get pregnant right away, you don't actually know until you're trying to do it and you see how your body reacts. So I think, like you said, having that extra time with the charting before you want to get pregnant can be very helpful for people. And I would certainly recommend that for people who want to have a child.
Yeah, absolutely. And it can be kind of a cool way to gauge your, I guess, your progress. So if you're working with a naturopathic doctor or a health practitioner or a nutritionist, having, just from my own experience of having charted for the past 10 years, when you make significant health changes in a positive way and work towards balancing out your hormones, you'll actually see your progress on your chart. Kind of, you'll see maybe your mucus cycles cleaning up. If you say, for example, someone had continuous mucus or quite a long mucus cycle, maybe 9-10 days of mucus, maybe after several months working with a holistic practitioner or working on nutrition, diet, you might see those mucus cycles shorten and look more robust and healthy. So your chart can serve more than just what you think. It can serve more than just using it for birth control or just picking the best day to try for pregnancy. It can also show you, oh wow, this diet lifestyle changes I've been making are actually I've got awesome mucus this month. This is great.
Yeah. And the other thing is, obviously it's not magical. Some women will need help from drugs and things like that. But in that case, at least they will have the knowledge and they'll have their charts and they can take it to the doctor and say, like, this is what's going on. I don't have enough progesterone in my body or things like that. I'm not ovulating. And they can actually show the charts to the practitioner. Whether or not the practitioner understands the charts is a different thing. I guess not all doctors have seen charts like this, but the woman will have that knowledge and she can work in partnership with her doctor. And, you can see, for example, if the time between peak day and the next cycle starting is short, that's a sign that there's not enough progesterone. So there wouldn't be enough time for an implantation of a fertilized egg to be successful. So she can use that information and say to the doctor, well, maybe I should take some progesterone or something like that. So, it's definitely useful whether or not you need drugs or can do it all naturally. Either way, it has a lot of really good benefits.
Yeah, no, absolutely. There was one thing that I thought about in terms of kind of going back to using the fertility awareness method for conception and kind of optimizing your chances for pregnancy. Did you want to talk a little bit about the role that an orgasm can play in optimizing your chances of pregnancy?
Well, there's some research. I don't know. It's one of those things that you hear different things about orgasm and pregnancy all the time. But one thing I have heard is that with orgasm, the sort of the uterus will basically the muscle contractions will cause the uterus to sort of suck up the sperm through the cervix. So I don't know if that's been completely established, but that is one thing I have heard in the literature. But in general, I would say that it probably doesn't matter if you're orgasming or not in terms of getting pregnant, because as long as the semen and the sperms are mixing with the woman's mucus, that's enough to create a pregnancy in a healthy couple.
Yeah,
So
absolutely.
orgasms, while they're fun, aren't required.
Yes, there's questionable research that shows that they might assist, but not
Yeah,
required.
no,
Um,
I'd say probably not. Yeah.
well, and one of the things that I had read when I read on your website was that you did some research in the area of sexual arousal and how it changes throughout the menstrual cycle.
Yes, I did. I just finished a research study on this, which was really exciting for me. So I am working, we're not quite finished yet, with a research center at the University of British Columbia. So it's the Center for Menstrual Cycle and Ovulation Research. And we did a study on how women's interest in sex is related or not related to where they are in their menstrual cycle. So basically, in the beginning of this, I did some research to see what all the other studies have found, and it's not consistent at all. So, we always hear in the media that women want to have more sex around the time of ovulation, and it's often talked about on a lot of different blogs about fertility and all this kind of stuff. So, while some women may have that, that may be true for some women, if we look on average, there's actually no difference. So, we looked at women's interest in sex reported on a daily diary across a whole year, and we ended up with 61 women, so that gave us over 10,000 data points. And when we looked at their interest in sex across the menstrual cycle, it was a completely flat line. So there was no difference whatsoever on a woman's interest in sex based on where she was in her menstrual cycle or where she was related to ovulation. So we weren't sure what we would find because, like I said, the data was kind of sketchy. Some things said there was an increase, some said there was no increase, some said there was a pattern, but it was a completely different pattern. So we weren't sure what we would find, but we did find a completely flat line. So while it may be true for some women, I'm not saying that's not true. Everyone is different, but on average, there was absolutely no change. And what we did find was that women's feelings of self-worth and feelings of energy are highly, highly correlated with their interest in sex. So what that tells us is something, it makes sense. Our emotions and our feelings about ourselves are far more important than what our hormones are doing that day. So this psychological and emotional factor is the most important thing, for sure. So that was quite interesting. I really enjoyed that study, and we're hoping to get it published. We sent it to a journal, so if it gets published, I can send you the link to that. But it was really exciting, and I think it's important from a sociology point of view and a social point of view, and that we're often told in the media and TV and everywhere that women are kind of like slaves to their hormones. But it's really not that way. There's so many other factors that go into how we're feeling and what we're doing in our lives. There's relationship factors, how you feel about your job, your health, what the weather's like that day, how old you are. There's so many different things. So that's far more important than the hormones in terms of how interested you are in sex.
That's a really interesting research because I know that being around this world of fertility awareness for quite some time, I've often heard and even said and probably written about how ovulation can be associated with an increased level of arousal. And I think you make an excellent point that obviously the hormones would be a factor
Hmm.
in a sea of other factors that are going to determine whether or not you're interested in sex. So I think that
Hmm.
it's a really great study. I mean, it's really great because it wasn't conclusive, because then it gives you more questions. It could
Hmm.
lead to more research.
Yeah, well, I think the big thing differentiating us from previous studies is that we had a whole year of data from over 60 women. So that was on average, it was 12 menstrual cycles per woman were submitted, whereas most of the other research is 3 cycles or less. So in such a short time frame, there'd be more factors that could cause the data to be skewed in some way. Whereas if you look at over a full year like we did, you get a much better average of the overall picture and the overall story.
Yeah, no, that's really interesting. And so those 60 women or 61 or 60,
61.
61, and so none of them obviously were on the pill or there would be no ovulatory cycle to look at.
Exactly, exactly. Yeah. So it was all women who were not on the pill, and they were all confirmed to be ovulating through hormonal tests before we started the study.
Well, I think to add a layer of interest, I think it would be super interesting to compare that data to a study done on, say, 61 women who are on the birth control pill and recording their um, sexual arousal,
Hmm.
patterns. I think that would be really interesting because there's so much information and research going around suggesting that the birth control pill can inhibit a woman's libido.
Hmm. Hmm. For sure. And there wouldn't be any hormonal pattern with people on the pill because they're actually not ovulating. So they wouldn't have the same pattern that a woman not on hormones would have. So they may have a pattern, but it would be much more unique to the individual than it would be. compared to a normal menstrual cycle.
Yeah, because that would be all those other factors outside of the hormonal
Exactly.
changes.
Exactly.
Well, I think that I have a couple more questions for you to kind of wrap up the show today. So, what would you say, I guess, to a woman who knows that she's maybe considering the fertility awareness method, or maybe she's considering going off the pill because she knows that she wants to have a baby? Not now, though. She's not ready now, but maybe within the next 2 to 5 years. What advice, if any, would you give to her?
I guess I would say kind of what we said before is that if you have been on hormones, it does have a big effect on your body, and it can take some time for your body to get back to normal. And while some women can be successful having babies right away, you don't know until you're trying what's going to happen. So having that time off the pill and having that time to see how healthy your cycle is and to make changes to improve your fertility will give you a better result in the end if you want to have kids in a healthy pregnancy. And I would definitely recommend it for people for sure.
Okay, and then if someone is considering the fertility awareness method and they have been for a while, but they're kind of afraid to make the leap, what would you
hmm
say to them? Words of encouragement, I guess.
Um, I mean, I'm a researcher by nature, so for me, the data is really helpful. So I read as much as I could in the beginning, and I looked at academic studies, and everything said how effective it was in terms of preventing pregnancy. So it's 99.6% effective at preventing pregnancy, and that's been shown in really big research studies. And lots of other studies have similar results. So for me, doing that reading and seeing that was helpful. Obviously, there's the difference between my intellectual brain and my emotional brain. So it still took me some time to get confident to do it. But I think if you're not sure, you can always just try it out and see how it goes and see what you think. You don't have to commit to it for the rest of your life. And you can use condoms or other barrier methods in the beginning while you're learning it and while you're becoming more confident. And then after a few times, you can start to see that it's working, and that's a big motivation, I think, for sure.
Yeah, I totally agree because I like the way that you phrase that the difference between your emotional brain and, yeah, I think that because I think that anyone who starts the fertility awareness for the first time must experience that. I know I did. And
hmm
I had read all the stuff. I was totally convinced, but it took me a couple cycles to actually try it unprotected.
Yeah, me too, for sure.
But
I think it's also,
just like you said, after you've seen the science, but after you actually see that it works firsthand, it gives you that added confidence.
for sure. And I think it's also important if the woman's in a relationship to have the support of her partner as well, because that can help instill a lot of confidence if the couple is kind of doing it together and they both believe that it works. And again, that can take a little while for the male partner to be supportive because the male, just like us, we grew up thinking we can get pregnant anytime. So that's, a barrier that they might have to get over. But, some tips, I guess. I mean, obviously depends on the relationship, but bring the partner with you to your sessions with your teacher or get them to read the book. And again, as they see that it starts to work over time, and as they see that they're not getting pregnant, then they'll know it's working and they'll become more confident. And then when they decide they want kids a year or two later, all they have to do is switch around when they're having sex, just have it at the fertile times instead of the infertile times.
Yeah, the learning curve for switching to trying to conceive is like 30 seconds or less.
Yeah. Yeah,
So
exactly.
once you got it down, you'll know. So I guess a final question then: what would be your favorite go-to resource for to recommend? I guess for women who are just learning to chart, or your favorite app that you use if you do use an app when you're charting your cycles.
Yeah. Well, I'm working with Justice, so Justice has its own program, its own online program or online app. So I would definitely recommend that one because it follows the specific rules and the specific mucus definitions that the method uses. So it's, for me, it's the most accurate one. And one really important thing about our app, or a couple of things actually are quite useful, is that it doesn't predict when you're fertile or when you're infertile, which a lot of other apps do, which is very important because no computer can tell you when you're fertile. You're the one who needs to look at the mucus and decide for yourself. So I think that's very important that it doesn't predict anything. As well, there's some self-test questions on there. So you can read through a list of questions, and if you're not sure about the answer, if you click no, it gives you a link automatically to the page within the Justice Guidebook that explains that particular point. So that's very useful as well. And then you can also link it to a teacher. So if I had a client who was using the app and using Justice Method, I could actually see her charts through this program. So that's helpful as a tool for me to teach her and for her to ask me questions. So definitely that one I would recommend. And the website, I guess I should tell you that as well, is justice-charting-app.com. So that's JUSTISSE-charting-app, so app.com. And it's definitely, it's a really good one. There's lots of other good ones too if someone's not learning Justice Method as well. For other symptothermal methods, Kindara is very, very popular. So that's probably the other one I would recommend for people who aren't doing Justice.
Okay, that's awesome, and I'll make sure to link that in the show notes. And I do have a question about the Justice Charting app. Is there a cost associated with it, or how does it work if someone wants to sign up? Because I think I've gone to the website a couple times, not too sure how to sign up.
Sure. So if basically it's a pay what you think is fair type of arrangement. So, if you don't pay, then you can only have one chart at a time and you don't have access to all the extra parts. But if you do pay, then like I said, you have access to the guidebook online and teachers and a self-test. But it's a pay what you think is fair type of arrangement because they understand that not everyone has a lot of money. So you could pay as little as, $2 a month or $1,000 a month, if you really want to support the organization. But so it's that would end up being like, $12 a year or $24 a year, which is a lot cheaper than any other birth control methods out there for sure. And it supports this organization and the teachers. And, there aren't many places that teach this kind of stuff. There's only 2 programs in North America that teach symptothermal methods from a secular feminist viewpoint. So I think it's important to support these organizations and spread the word, I guess.
And just for our listeners who might not be familiar, so Justice would be one of the organizations, and then the other one is?
Yep. It's called Grace of the Moon. So it's a woman, I believe she's in Washington in the States, and she teaches women how to be reproductive health practitioners and fertility awareness educators. So that is the other one. And there's differences between them, so depending on if someone does want to learn how to do this like I am, they are similar but different. So I think it's good because it provides a variety of options for people. But again, it's just the 2 to choose from. There's really not that much. So I think the more of us do it, the better.
Yeah, absolutely. My hope is that, of course, this knowledge becomes a bit more mainstream because it's fairly basic biology, and I feel like it's not so hard to learn. It's helpful to have a teacher to help to kind of get you started and make sure that you understand how to do your observations correctly, how to interpret your cervical mucus, especially because there's so much variation there, and especially to have that support so that if you do identify issues on your chart or if you have issues with hormonal imbalances, that you have some support, so you don't just feel like you're alone in your house with a chart that doesn't make sense, and then you kind of just throw it to the side and go back on the pill. So just so that you don't feel alone, I just hope that this information and knowledge can become more mainstream.
Me too, for sure.
Well, Allison, I'd like to thank you so much for hanging out with me today and sharing your knowledge and experience with
Thanks
our
for
audience.
Having me.
Yeah, it was awesome. I love having these conversations, and it's definitely one of my favorite topics. So.
Me too.
And so if our listeners today would like to get in touch with you, or if they'd like to book one-on-one session with you, if they're wanting to have you as their teacher, how could they get in contact with you?
Sure. I've got a website where it's got all my contact information for, I have a Facebook and a Twitter. So the website is my name. So it's AllisonMacbeth.com. So ALLISONMACBETH.com. And they can find me on there.
Okay, and I'll link to your Facebook and your Twitter as well in the show
Great.
notes, just in case anyone wants to hang out with you and chat with you on Facebook and Twitter. And
Sounds great.
so thanks again, Allison, for being here, and I'll talk to you again soon.
Thanks.
So thank you all for listening. You are so awesome. If anything that we talked about today, if you found it interesting, or if you wanted to make a comment, or if you wanted to tweet me, you can again tweet me at Fertile Friday. You can stop by the blog and leave a comment in the show notes for today's episode. So you'll find today's episode at fertilityfriday.com/Allison. And you can also find me on the Fertility Friday Facebook page. So that's facebook.com/fertilityfridays with an S. So until next time, be well and happy charting.